Good afternoon, everyone. I think we'll get this webinar started. It is March 10th, 2021, and thank you for joining us on your noon hour today. I hope that you are able to enjoy our company virtually and get some great takeaways with the information that we're going to hear about. I am Debbie Deere, and I will be your host today, along with my colleagues Bria Cudney and Hannah McGahee. And we are all happy to welcome you from the Kansas Children's Cabinet and the All In for Kansas Kids Strategic Plan. So our agenda today is very simple. We are going to give our normal general updates to start with, and then we are going to be hearing a presentation from the Kansas Association for Infant and Early Childhood Mental Health Professionals. And so we have a panel, I believe, of presenters today. So definitely going to be spending the majority of our hour letting them share their information with us. So with that being said, I'm going to jump right into our general updates that we like to share with you every 2 weeks. The first one, the Thrive Allen County is going to be sponsoring a youth mental health first aid course. And this is available for anyone 18 years or older, and it's a 7-hour blended mental health course, and it's free and it's in person. Yes, you heard me say that right. It's an in-person class, and it's going to be teaching you how to offer initial help to people with the signs and symptoms of a mental illness or who are possibly in crisis. So this is taking place on Tuesday evening, March 30th, and Saturday morning, April 10th, at the Southeast Kansas Mental Health Center in Iola. The email is listed here for Michelle Hogue if you would like to register and have any questions, and that deadline to register is noon on March 31st. We are inviting childcare providers to share your experiences with us. The team from the All In for Kansas Kids Strategic Plan is in the first phase of a project to identify the barriers and opportunities in the childcare provider experience. And so the link that's available here will take you to a survey that is going to take 10 minutes or less to complete. So we thank you in advance and appreciate the time that you might take to complete this. By March 23rd is the deadline, and the information that we gather will prove very helpful to continuing our work in early childhood, in informing the improvement and supports that to make to the child care process. Last month we were able to, or last webinar, 2 weeks ago, we were able to hear from the Kansas Breastfeeding Coalition, and they shared a lot of valuable information on the work that they do in Kansas. And so now they are wanting to announce a 2021 breastfeeding capacity grant. The request for proposal is out, and you can find it at this link that's being provided. So proposals can be submitted for up to $2,500 to fund activities that can strengthen the leadership and capacity to increase breastfeeding rates in Kansas. And those proposals must be received by 5 p.m. on May 3rd. And you can also email at info@ksbreastfeeding.org with any additional questions that you might have. There is also monies available that can be applied for to the Low-Income Energy Assistance Program to help Kansans pay for any upcoming utility bills. I mean, we all know from the pandemic that we've experienced over the past year, the hardships that has caused, in addition to the terrible cold spell that we experienced last month. Those utility bills just keep coming, and they're getting larger because of the cold spell. So applications need to be received for this before 5 on March 31st. Paper and online options are available. And you can go to this website and apply. Please apply yourself, tell other friends that you know who might be needing this assistance, as well as agencies and organizations that you work in. And now it is time to enjoy our program for today. So I would like to introduce Lana Messner, who is the project coordinator for the Kansas Association for Infant and Early Childhood Mental Health, and let her take it from here. So welcome, Lana, and thank you for joining us today.
Well, thank you for having us. We're really excited we get to talk about our favorite topic, which is infant and early childhood mental health. So can you see the PowerPoint? Great. So Beth Blubaugh and I are going to talk about the KAIMH endorsement a little bit. Linda Logan, Trina Morgan, and Rochelle Soden are going to talk more about the work that we're doing together with them around professional development and reflective supervision. So we are so excited to talk to you today about the KAIMH infant mental health endorsement as a workforce strategy. So see if I can get this slide to move. Oh no. Let's see, there we go. Okay, so what we wanted to try to accomplish in the next 30 or so minutes is to connect KAIMH's mission and activities with the work that you're doing around this state and explain how the infant mental health endorsement is relevant to the infant and early childhood workforce overall and specifically in Kansas. We're also going to tell you a little bit more about the different categories of endorsement and identify those steps necessary to get you started on your endorsement application process. So oftentimes we'll hear, well, I don't do mental health. I don't know how to do that. Why would I want to get an infant mental health endorsement? But when most of us know that we know that anyone who cares for infants and toddlers and their families or on behalf of them is a mental health person. Everything we do and say relates to mental health. So just so we're all on the same page, we use this definition of infant mental health. It is the developing capacity from birth to age 3 to experience, regulate, and express emotions, to form close relationships, and explore their environment and learn. And that all happens in the context of family, community, and cultural expectations for very young children. This was a definition that was developed by 0 to 3's Infant Mental Health Task Force way back in 2011. That doesn't seem like that long ago, but it's already 10 years old. So it's a pretty established bar in the field. So why Kansas? So KAIMH is focused on supporting the recognition of professionals who work with or on behalf of infants, toddlers, and their families. The KAIMH infant mental health endorsement is the most effective workforce strategy to achieve this goal. To support the endorsement, KAIMH also offers professional development events and ongoing reflective supervision as a professional development strategy for all endorsement applicants. Trina Morgan is going to tell us a little bit more about how KCSL offers reflective supervision and consultation to their staff. And then Linda Logan and Rochelle Soden are going to tell us a little bit more about how their agencies have developed crosswalks with the courses that they offer to support endorsement applicants. So this is to give you a little bit of background about where the endorsement came from. The endorsement is actually owned by the Michigan Association for Infant Mental Health. They developed a set of competencies that were purchased by all of the states that you see here in green. There are also for currently 3 countries, and I think another in the works, who have purchased the endorsement. Those states in blue are ones, and countries that are in blue are the ones that are currently in the process of exploring purchasing the endorsement, and maybe at some stage of discovery about whether they're going to implement it. As of the end of last year, 2020, there were more than 3,800 infant and early childhood mental health endorsed professionals across all of the 32 states and countries. Of course, we don't want anyone to leave Kansas, but if you happen to, the endorsement will be recognized in any of the green colored states and countries who also have the infant mental health endorsement. And likewise, when someone moves here from one of these states or countries, it can be recognized in Kansas. So the infant mental health endorsement is a reflection of Kansas's commitment to best practices in the infant and family field. And this really, the endorsement recognizes a wide range of professionals. For example, home visitors, infant and toddler teachers, and family child care providers, others like mental health consultants or clinicians, and many more. So the KAIMH Infant Mental Health Endorsement recognizes a person's education, training, and work experience specific to supporting the mental health needs of infants and toddlers. And it also verifies that someone has attained a very specific level of functioning and understanding about the promotion of infant mental health. And the endorsement provides that level of assurance to families, coworkers, organizations, and the larger community that the person who provides these services to infants and their families meets a set of standards that support the optimal development of the child. That set of standards we call the endorsement competency guidelines. KAIMH purchased the license to these guidelines so that we could uniquely support the infant mental health workforce across the state. Only state infant mental health associations can purchase the competencies and thus sponsor endorsement. We also want to point out that the endorsement is specific to the work with or on behalf of young children ages birth to 3 and their families. We want to also tell you that there's an early childhood mental health endorsement that was recently developed for professionals who work with preschool age children and their families. And KAIMH has plans to purchase this endorsement in the near future. So these are some comments by some of the folks who have gone through endorsement. The comments, if you notice, really reflect a powerful impact that the process of building a portfolio, attending professional infant mental health specific professional development, and participating in reflective supervision and consultation can have on early education practitioners and leaders. Here are 4 career pathways that the endorsement focuses on. It recognizes the participation of experiences that lead to competence in infant and early childhood principles and practices. And the endorsement acknowledges a professional's choice to specialize in a particular area. One of these categories is not better or higher than another one. They really just zero in on the work that the professional has experience in. So all categories recognize those who work with infant mental health principles, and all categories are applicable to many different disciplines. So for example, on the far left, it talks about the infant family associate, or the IFA, the promotion. That's generally been for early care and education providers, but not exclusively. We also, this area also recognizes administrators, case managers, and maybe after school or wraparound care providers. The next category is IFS, or infant family specialist. This is a much broader category, and it's been a good fit for professionals who may be home visitors who provide support and education to families of infants and toddlers, maybe like home visiting for parents as teachers, Healthy Families America, mental health consultants, Early Head Start or Part C, or Tiny K. On the next column talks about the infant mental health specialist. And this is really a little more focused on those folks who provide mental health services to address, and maybe relationship-based therapies to address what some of us might be familiar with as ghosts in the nursery. Infant mental health specialists come from many disciplines like occupational therapy, from education, social work, human development, psychology, but most, but not all, are licensed mental health professionals. And on the far right, we move over to the infant mental health mentor. It's also subdivided into 3 different categories. The subdivisions are clinical, for those who provide reflective supervision and consultation. There's the policy subdivision for leaders in policy, program design, and program administration. And then research and faculty is the 3rd subcategory for those in academic settings, conducting research on infant mental health and teaching about infant mental health principles and practices. So this slide looks at all 8 of the competencies that are included in the competency guidelines. Each of the 4 categories of endorsement must address each of these areas of the competency guidelines. And this is really the foundation of the endorsement. All of the different categories, each endorsement applicant must identify. But they're slightly different for each of the different categories. So for example, under theoretical foundations, if you're applying under the infant family associate, the competency that you need to address is you share information with families and show an understanding of infant and family relationship and development. Under the infant mental health specialist for intervention, the theoretical foundation that we're looking for is someone who can develop service plans that take into account each infant or very young child's unique family needs, desires, history, lifestyle, concerns, strengths, resources, cultural community, and priorities. So reflective supervision is also required for infant family specialists, infant mental health specialists, and infant mental health mentors at the clinical level. Reflective supervision and consultation goes beyond clinical supervision to a shared exploration of the parallel process. For example, attention to all of the relationships, including that between the practitioner and the parent or caregiver, between the parent or caregiver and the infant or toddler, and between the practitioner and supervisor. It's critical to understand how each of these relationships affect the other. Of additional importance, by attending to the emotional content of the work and how reactions to the content affect the work, reflective supervision or consultation relates to the professional and personal development within one's discipline or work. Participation in reflective supervision consultation can be a model for how participants should be with children, families, and clients. So the components of reflective supervision and consultation include forming a trusting relationship between the supervisor and practitioner, establishing consistent and predictable meetings and times, asking questions that encourage details about the infant, parent, and emergent relationship, listening, remaining emotionally present, teaching and guiding, nurturing and supporting, integrating emotion and reason, fostering the reflective process to be internalized by the supervisee, exploring the parallel process and allowing time for personal reflection, and then attending to how reactions to the content affect the reflective process. So you can see reflective supervision and consultation is really different from clinical or managerial supervision. Reflective supervision is also another professional development strategy. As some of you may have heard before, Jeree Paul puts it really great. We know that how you are is as important as what you do, and reflective supervision addresses that. So Beth's going to tell you a lot more about the details of each of these and what's required to achieve endorsement.
Hi, everybody. I'm the association coordinator for KAIMH, and so I am the one that helps our applicants as they come through with any questions that they have, any technical issues they have, and really just try to explain this process. I tell everybody, even though we use words like reviewing a portfolio or passing an exam, that it really isn't a pass-fail. This is a working document and we are your friend and we're gonna move forward with you with this. So it's not a one strike, you're out type thing. So with that, I'm gonna talk a little bit more detail about the different categories that we have and how one might see if they're a good fit with that category, or go through checking off the steps of the requirements. There are a lot more to what I'm just saying, so I'm just kind of going to give you a brief overview, but I'm happy to answer questions that are specific to individuals' situations as they come up. So when we look at the first category, the infant family associate, that's that promotion category, that promotion field. And so any academic degree or a child development associate. So, or an associate's degree, or for this category, it can be 2 years of early childhood experience, and it can be related volunteer experience. So this really looks like a wide variety when you look at our degrees, because we'll have those that have the work experience and no degree, and then you can have PhDs and clinicians that have come through and gotten this category. Some examples might be an infant teacher in an early childhood education program, a doula, a court-appointed special advocate worker, a child life specialist. When you think about our professionals that are out there in the promotion field, it does require 30 hours of professional development or training that is pertaining to social emotional development or practice of infant and early childhood mental health. And you don't need to have all of these boxes checked off if you apply to start filling out your portfolio. That's kind of where I bring in the working document. When you begin the endorsement process, it can take an applicant an average of 6 to 12 months to complete their portfolio. And so there's no time limit once you apply to fill all this stuff out. It will stay and it will hold and it will keep as you do your running document of trainings and education. A valuable part of the process is being thoughtful about what you're bringing with you while also mapping out how you can continue to enhance your work. So that's why we say it can take 6 to 12 months. We want that reflection piece in there. So when you have people coming through, we just really encourage them to think about this as a fluid and supportive process. So no strikes. As we go to the next slide, there we go. Infant family specialist, that's more of that prevention category that we talked about. So Lana had mentioned our Part C, our early Head Start, our Tiny K, parents as teachers, healthy families, mental health consultants, those type of prevention programs and professions. So for this one, you have to have a minimum of a bachelor's degree. You can see all the other different types of degrees that are listed there too, but at a minimum, you need to have a bachelor's and then 2 years paid work experience after you have completed your degree. And then the work experience also states that you need to have working with a minimum of at least 10 families of children from that 0 to 36 month age range, with services being on social emotional needs, and really including the relationship surrounding that child's mental health. And then another part of this one that's different, that's a little more intensive than the associate level, is that supervision is required. That reflective supervision piece that Lana just talked about is required at least 24 hours within a 1 to 2 time year frame. So they want the supervision to be at least 1 year in length, but for you to get all 24 hours before 2 years expires. So that's that 1 to 2 year time frame, what that means. And then the reflective supervisor must meet requirements for infant mental health endorsements, at least at this specialist category, or those other categories, the mental health specialist or the mental health mentor. And official transcripts are required. That goes into having our portfolio reviewers just really check a lot of the college courses that one takes, like speech class, that counts for competencies for communication. So it really just helps build that solid portfolio to make sure all competencies are met, and really just builds that up. This is when we think about direct service or previous direct service providers, this is where that category fits. Sorry, Lena, you can go. You can go to the next one. So when we think about that third category, the infant mental health specialist requirements, you can see the education requirements are on there. It's very similar to the last category we talked about, except at a minimum, this category requires a master's and 2 years postgraduate supervised with both infant and young children and their primary caregiver, really working on that relationship component. And then 1 year of supervised graduate internship with infant mental health practice, that can be counted to the 2-year paid work experience past your graduate degree. So if there is a supervision internship in there, then that can be counted for that 2 years. And then this is 50 hours of reflective supervision within that 1 to 2 year time frame. And then that reflective supervisor meeting the criteria to be endorsed at an infant mental health specialist or mentor category. This is the first category that requires a successful completion of the written exam. We do provide a resource for study guide for that, and it's intended to explore issues related to attachment, separation, trauma, unresolved losses, effective development, behavior, care of infant and young child. So that's an overview of this category. If we go to the final category, the infant mental health mentor, that's where we're really looking at the leaders in our state. And this has 3 different designations. So we can have mentors in a clinical field, in a policy field, or in a research faculty field. For this one, it is a minimum of a master's degree. And you can see all the other options of degrees there that can be out there. And then specialized work experience. Now for clinical, that needs to be in kind of like that therapy mental health provider, where it meets the specialized work experience that we had for the mental health specialist, which is the 2 years post-degree work supervised with the infant or child with their primary caregiver. But we also want that 3 years of reflective supervision provider piece there for the clinical. And then policy and research has the specialized work experience criteria of 3 years postgraduate experience as a leader in policy or program administration or teaching in a university or has published research. We want everyone to meet the specialized work experience plus kind of the extra leadership criteria and have that provider or experience of being a provider for reflective supervision. So that's kind of a quick overview of the differences between the categories. When you look at that final mentor category, there is still that 50 hours of reflective supervision within a 1 to 2 year time frame. It is only required for our clinical group there. It's not required for our policy or research faculty. It is recommended for those groups because it's very beneficial, but it's not a requirement for them. And then also there is a written exam for this one that looks different than the mental health specialist exam, kind of set up the same way, but different criteria that they're looking for and different questions. And it's geared towards their category that they're applying for policy or clinical or faculty. So sorry, Lana, you can go forward. So what are the steps to, if you want to start doing this, or if you want to share this with staff and coworkers on how they get started? And the first step is really inquiry. And that can be done either by reaching out to us and asking questions, and we can send documentation, or it's posted on our website too, where you can look at the brochure and really look at the categories and see what the competencies are and what the requirements are and see if there's a good fit. And then when you feel like you know that you're ready for a good fit or you found the category that you like, we have an online system. It's called Easy. It's endorsement application system. And you fill out that information on there like you would sign up for a training or something like that. You would sign in, fill out your information. It would generate a username and password, and then it stores all of your information in there for you to write down all the competencies that you think you're meeting through your education, through your training. Everything gets uploaded right there. So it really is this online portfolio kept in one place. And a lot of professionals have liked it because when they go to write a resume or do something later, all their stuff is kept right here in this nice little portfolio for them in an organized package. You would complete that portfolio and just show that you've got documentation of all the competencies that Lana had mentioned briefly earlier. And then you would submit that. There is a review process where 2 reviewers would look over it and say, yes, I think this portfolio looks complete, or no, we need a little bit of more information. And then for those that are applying in the categories where we require an exam, that would be scheduled on. If you pass the portfolio review and you don't need to go on and take the exam, that's it, you're endorsed, you get a certificate. And then for renewal each year, it's just turning in continuing education hours that you have or that you've provided relevant to the category that you've applied in, and then you're endorsed and you stay endorsed. So this pie image, it's because this is easy as pie or sweet as pie. So this is a visual. If you think about the category requirements, having so many hours of training and having a degree in a specific category, then that's our crust. That's our crust on the outside, that's our top, that's our bottom. It's kind of holding everything together. And then you think of all those competencies that were mentioned, you know, the communication, agency policy, theoretical foundations. That is our fun little filling. So this was the visual that we wanted to show today.
Thanks, Beth. I'd like to introduce Rochelle Soden and Linda Logan to talk a little bit about the professional development that they've developed to partner with around the endorsement. So, Rochelle.
Hi, good afternoon, everybody. Hoping you can hear me okay. My section is just really brief, and just to say that we are super excited to have KAIMH as one of our partners in thinking about how the endorsement is a systemic way to impact and really support quality care in our early care and education systems. And so as with Kansas Children's Service League, my role is a training manager, and one of our projects, which is partly new to the preschool development subgrants, is a curriculum called Connections Matter, which some of you are partnering with. And in talking with Lana about how that can tie into KAIMH's endorsements, we realized that many of our training curriculum with our prevention and community-based education programs would fit nicely into meeting the needs for their endorsement criteria. So we have worked in the past couple of months to do what they are calling a crosswalk to plug in our training curriculum to help meet those endorsement areas so that the professionals can pick and choose different courses that they are wanting to take that meet those competency areas. And then with the Connections Matter curriculum, which is new to the state of Kansas, we are working with the implementing team to make sure we have specific language that is referencing infants in the areas that we cover with that curriculum that are in the attachment areas and the brain development and relationships, so that it is absolutely meeting the needs for KAIMH's endorsement competency areas. So we have that crosswalk done. If people are interested in finding out more, Lana can get that to you. And I know Linda has a lot more curriculum that they have partnered with, so I will pass that on to Linda to talk about Casito's partnership there as well.
Thanks, Rochelle. Lana, I'm wondering if I could share my screen so we can just preview the crosswalk that we did. So I don't do a lot of talking without a visual. Okay, great. Okay. So you're looking at a crosswalk that Lana and I talked about, and I put together when we were trying to get a concise, outline for those that are interested in endorsement to have professional development opportunities. And
Linda, I think you're sharing your teams. If you could get back to the crosswalk, I think.
great. Okay. Thanks for stopping me.
Yeah, not a problem.
Okay. How's that?
Great.
Okay. Great. Things always work so well in your mind, and then we have these little glitches, right? So anyway, put this together so that those that are interested in endorsement would be able to feel supported with professional development opportunities. And we're certainly excited to work along with KAIMH and KCSL. In fact, one of our courses, as you can see, under the theoretical foundations, strengthening families through positive connections, is a KCSL course that Rochelle herself is teaching. So we really tried to embed all of this, and this is just for the infant family associate. What we are going to kind of try to target was those first two types of endorsement. I think most of you know that Casito has a whole catalog of courses that we offer throughout the year. So these are not all available every week. And we do the planning at every 6-month intervals. So kind of wanted to highlight some of these. Breastfeeding, the Breastfeeding Coalition presented at our last meeting, and we also host their online course as well. So really feel like it's got a good variety of opportunities, but we don't have everything, so that's okay. The other thing that I wanted to mention along with this kind of all evolved at the same time, is that Casito and Casito Kids ITSN, Infant Toddler Specialist Network, also decided to make the commitment with KAIMH to get staff endorsed. So there are several of us that have started on that journey, and we're very excited. And we all come from different backgrounds in the early childhood workforce. And I know Beth is probably tired of all of us calling and saying, but I've only done this. Does this count? So anyway, just like I said, wanted to reassure that there are multiple opportunities for the professional development with endorsement, and we're looking forward to continuing our partnership with KAIMH.
Thanks, Linda. There's a lot of infant mental health specific information and training that we wanted to make sure is available. So whenever anyone applies for endorsement, they'll get a copy of the KCSL and the Casito crosswalks so they can review their professional development that they've attended in the past and be able to plug it into each of the competencies as they build their portfolio. So Linda, I wanted to have you talk just briefly about what's coming up April 29th and 30th.
I'm so glad you asked. So another part of my role is I just happen to be the co-education committee chairman and for our annual conference. And that is coming up April 29th and 30th. It will be virtual. And our presenters are Shanna Smith, who many of you know, and she will be spending the day with us on Thursday. And then, nope, she will be spending the day with us on Friday. See, I always get those mixed up. And then Ann Meeker will be presenting Thursday morning. And then if you're interested in endorsement at all, that afternoon on Thursday would be a great time to get some more information about endorsement, because there will be several sessions then provided that afternoon on endorsement, reflective supervision. So very exciting. You are able to register for just one day or both. And we're really hoping that everyone signs up and joins us. And we're hoping also that registration will be available, if not this Friday, the coming next week. So anyway, thanks, Lana.
Yeah, great. Well, KAIMH is really eager to partner with other professional development organizations. We really don't want to reinvent the wheel, but we want to make sure that our endorsement applicants know where they can get infant mental health specific professional development whenever possible. Recently, we've also partnered with the Kansas Pyramid Collaborative, and we'll be providing some scholarship funding for people to take the virtual pyramid model modules online as well through Brooks Publishing. So we're really excited about that partnership as well. Trina, would you talk a little bit more about reflective supervision and why KCSL decided to offer reflective supervision to its staff?
Sure, thanks, Lana. I'm Trina Morgan, and I'm the Healthy Families Assistant Director for our West Region here at KCSL. And I also happen to sit on the endorsement committee with KAIMH, so I'm a huge proponent of this, and it's been exciting to work with them more. We really encourage our staff to go through the KAIMH endorsement, and part of the reason that we chose to really kind of heavily push this is that home visitors do extremely important work, and there really isn't a certification or a degree or a license that home visitors specifically can get that show a certain level of professionalism that they achieve and the importance of our work with these families. We did briefly look at the home visitor CDA, but we ultimately felt for us that the infant mental health endorsement was the best fit to show how our home visitors had achieved a level of expertise in their field. We do offer a salary stipend as part of this process, and the reason we decided to do that is that we felt like the KAIMH endorsement wouldn't only be helpful for individual home visitors as something to add to their resumes and show what they had achieved, but also for our agency. It gives us a way to show funders, community partners, board members, that our staff have achieved this important certification, that they're maintaining this certification. Now, we also knew that a number of staff would not want to get this endorsement because of their own internal motivation. So we felt like it was important to offer a salary increase in order to possibly motivate, but also to recognize the work that these staff have gone through to get this. So it is not a requirement of a job with Healthy Families, but if they achieve their endorsement, our staff do get a 2% salary increase, and that is from supervisors down. So it's definitely a benefit and something that we're proud that we are able to do. One of the other questions I was asked to talk about was how and why we provide the reflective supervision consultation within our work. The Kansas Children's Service League's Healthy Families programs each have a monthly reflective group supervision that is led by a master level clinician who's either been endorsed or vetted by KAIMH. These are 2 hours meetings every month. And this is in addition to the 1.5 hours of reflective supervision our staff get directly from their supervisor every week. The Healthy Families model does not require group reflective supervision, but they do recommend it, and they do have standards around it that programs are encouraged to utilize. So our work with families is very relationship based. Our home visitors are trained to use reflective strategies with families to help those services really get delivered in a strength-based way, and really working to empower parents to be attuned to the needs of their children. The most important part of the group and the individual reflective supervision is to work on how the home visitor is feeling. We find it extremely, extremely important in this work to put some reflective work into how and what that home visitor is being affected, how the work is going or isn't going, and less about dotting I's and crossing T's. So that's part of why we really find this important. And my staff, I will tell you, they look forward to their groups every month and they have nothing but amazing things to say about how group reflective supervision benefits them. So.
Thanks, Trina.
You're welcome.
Well, let me show you one last little bit here. So, KAIMH is all in for Kansas kids, right? With funding made possible from the Preschool Development Grant, KAIMH is able to waive application and processing fees for up to 26 people each year as a part of this 3-year grant. We also have some additional funding and scholarships we're seeking to support professional development and to offer monthly advising groups. We're also planning some very intensive reflective supervision training to be able to build capacity for people to be able to access reflective supervision a little more easily. So in the chat function there, Bria posted a handout on the steps to endorsement, and we hope you find that helpful, and we look forward to hearing from you. We have, here's our contact information if you would like to reach out to us directly to ask more questions, or if you have any questions right now, we're happy to try to answer them.
I do see a couple in the chat box that we might address here quickly if we have time. Rich had asked, how does work with families prenatally factor into endorsement? And it really depends on that type of work. Of course, prenatally goes right into that promotion piece. So working with our families that are expecting and really talking to them about what that's going to look like, what attachment looks like, what infant care looks like, all of those things goes into that promotion piece. Of course, the other categories say 0 to 36 months. So once the baby's born, if that work that was there with them prenatally then comes to be a little bit postnatally, then it could move over into some of those other categories. So we do have nurses that are applying for the infant family associate that do a lot of the prenatal work and a lot of the first few hours of birth and those first few days. So it really just depends on the type and the scope of the work, but easily falls into the family associate for promotion. And then I see Shannon says she's excited about the preschool version. So are we. And then Kim, you had said any time frame on the availability of early childhood mental health. I don't have a good time frame for you, except that we're all screaming soon. But I don't really know what soon looks like. So I'm sorry, I can't give you more of a definite, concrete answer on that.
We are seeking funding to try to support purchasing the early childhood mental health credential or endorsement as well. So hopefully soon. Any other questions? Thank you so much for giving us this opportunity to talk about our favorite topic.
Thank you, Lana.
Well, thank you, Lana, and to all of your partners that shared information with us as well today. Learning about the endorsement and the different options that we can consider to enhance the professional development and experiences of our Kansas early childhood workforce is wonderful. And, you know, the virtual conference that was mentioned, if people are interested in that, as well as just the opportunities for some scholarships and things. So all of those things combined. Good information today. So thank you. And the bright and colorful happy hands graphics just made me smile today. So to wrap up our webinar, we just have a few reminders that we have an early childhood recommendations panel meeting coming up next week on Friday, the 19th. And you can register and view that through YouTube. It's available on the cabinet's website, as well as previous panel meetings. Our next bi-weekly webinar is in 2 weeks, Wednesday, March 24th. And please always let us know if you have topics that you're interested in, or if you work within an organization or have something going on that you feel would be valuable for us to share. So you can also reach Bria Cudney. If Bria could put her contact information, if you haven't already, in there for people to get a hold of you at. We have a cabinet and stakeholder group meeting coming up on April 9th. The cabinet meeting will be in the morning from 9 to noon. And then the stakeholder group meeting will be in the afternoon from 1 to 3:30. The stakeholder group meeting, we invite everyone to attend. It is participatory, so you are able to come off mute. You can comment in the chat, and we always have really fun and valuable information for you to take away from that. The cabinet is still working on their monthly feedback question that they are going to post for everyone to respond to. So just stay tuned for that. That's still in the works. And when that comes along, we'll surely let you know. So that is it for today. Thank you again for spending your noon hour with us. We look forward to seeing you in a couple of weeks.
Thank
Have
you.
a great day.
See you.
Thank you.
Thank you, everyone.